All right, so it is May 13th, and so the Board of Health, Town of Fairfield, is called to order. It's just 7:30 now. And so before we start, everybody had a chance to review the minutes from last meeting? Any changes, corrections? Have a motion to approve?
Tracy, I'll
Second. All in favor?
favor.
Aye. Any opposed? No. Minutes are approved. So we can go on with Sam's report.
Sure. Okay. So both the CDC, the state, and ASTA, which is the Association of State and Territorial Health Officers, and the sort of Federal Association of Epidemiologists have all had conferences on HPAI, highly pathogenic avian influenza. So I thought I'd share some of that and some of their concerns regarding that. So I stole just a few slides from it. Hopefully not too many. But yeah, just basically they gave a global. There is a global outbreak going on right now. First detection in 22 in wild birds. February 22, detected in poultry. They've been having an ongoing response, looking to eradicate in poultry, a lot of culling of poultry, and occasional detection in other mammals, skunks, raccoons, things like that. And then recently, they had a detection in cattle, and specifically dairy cattle. So they've been, so all milk from dairy cattle that are showing symptoms, what they initially saw was like a drop in production of milk, and then they did some testing and found it in dairy cattle. And so they've been the same, they cull the chicken, but with the dairy cattle, they throw out the milk and wait until they recover and the milk tests negative. I'm going to start the slideshow. Okay, what is that? Okay. Let go. I've got it. Okay, so I guess we're on that screen now. So it's been widespread in birds, and outbreaks in poultry, and just now getting into cow. And there's been one human case of somebody with that works with dairy. It was a very mild case. He only had conjunctivitis, but he was working with dairy cattle, and so they tested all the workers, and he came up. So, and there was one other case in 22 with an individual who worked with chickens in Colorado. So essentially there was two cases. Mouse is driving crazy. Two cases in people. It's, again, dairy cattle, it's going through right now. Wild birds, it's already been widespread. Poultry, sporadic outbreaks. It's mammals, it's happening. There hasn't been any person-to-person spread, and so they are still saying the current public health risk is low. So here's where we are as of today's CDC. 9,000 wild birds have been tested, 90 million poultry affected. There's currently, with wild birds in 50 jurisdictions, poultry in 48 jurisdictions, states, basically. Dairy cattle have been in 9 states with 36 herds affected. And so they've come out with some protective actions. For most people, there is nothing, the general population, other than, to ensure you get your seasonal vaccination so that, so there's less a chance of having human influenza and HPAI influenza at the same time, so there's less chance for genetic mutation. And so the only really measures they're saying is for people that work with cattle or work with poultry. And then just not, touching if you see a wild dead bird, not to touch any. So just some of the interesting things here about impact on diagnostics and antivirals and candidate viruses. They're not finding any difficulty in detecting it with the current diagnostic assays they have. In treatment, they've shown no markers of resistance to the current antiviral drugs that are used for influenza. And they have 2 candidate vaccine viruses that appear to offer good protection. So it's some of the interesting things. I pulled out some of what I found interesting. They did find this in a conjunctival specimen, but not a nasopharyngeal specimen. They seem to say that suggests lack of respiratory transmission at this point. It's the same clade that's been circulating since late 2021, so it's not showing rapid mutations yet. And the human virus sequence is identical to what's in cattle and birds, so no significant genetic changes. You know, and some indications that it lacks changes for adaptation to better infect males. And so just some of the countermeasures that the feds have, you know, in the strategic national stockpile, they've got the gloves and the goggles and the face shields, they've got the antivirals available, stockpiled, they've got the candidate vaccine viruses, they've got adjuvant stockpiled, and then they also have some H5N1 vaccine already available in prefilled syringes and vials, and they have 10 million doses of bulk antigen. So, and they feel they're able to ramp up quickly. So they have countermeasures in place and available. And then the other question everybody asks, well, how safe is the milk? They did find the detection of the virus in milk, but it was just a viral fragment that wasn't capable of replicating. And so they feel like the pasteurization process is working. And so here's the FDA has come out and said there's, you know, continues to be no concern that poses a risk to consumer health at this time. They only get milk from healthy animals, and it's everything that's authorized for interstate commerce goes through a pasteurization process. So they're feeling that the risk is low, and there's no concern about milk safety at this time. 99% of the commercial milk supply is grade A and compliant with the pasteurization. So that's it about HPAI. I thought I would show just what's going on with the measles outbreak that's currently going on in the United States. You know, it's up to 132 cases in 2024 with the age breakdown there and the vaccination status there. And the hospitalization percentage that were hospitalized. It seems to appear that it's on its way down, but the feds are keeping an eye on it. And then here's what's going on in Connecticut right now, just in terms of respiratory viruses. Most all are coming down, with RSV in the purple is back to background levels. COVID in the green is back to background levels. Influenza is almost there, probably a few more weeks and it'll get back to background levels. And then here's what's going on in Fairfield. This is the all of 2024. We've had 156 cases. There's, you all know there's likely a lot more, but this is what's being tested. Had a few cases, a case of E. coli, 2 cases of salmonella, a few other little sporadic cases of other things. RSV is 134, and so 906 different communicable diseases reported so far this year. And so the ones that we really take action on now really are the E. coli and the salmonella. All get interviewed either by us or by what's a program called FoodNet, which is a Yale program that cooperates with the state to make sure that, all foodborne illness cases get interviewed. And so they do a little bit more research type things with the data. So this is what we're having. And so we're not seeing a large burden of, interviews that we have to do going on, no significant outbreaks in establishments. And some of the good news of what we've had, we did have the Mill River portion from above the Mill River Dam. They lifted a restriction, a consumption advisory for blue crab, so now people can eat blue crab from the Mill River. So it's indicative of the success of the remediation that they did in the river over the last decade. And so in 2022 and 2023, they were doing sampling of the meats. And so they said it's safe for consumption other than the tamale, which was a word I never heard in my life before. Does anybody know what tamale is? It's the green stuff inside the crab, apparently. When you open up a crab, I've seen that in lobster, I think, before, but but the green stuff inside the crab is called tamale, and that's the part that they say you shouldn't eat that. And so what's going on for the health department right now? One of the big things we're doing is working with the Health Improvement Alliance, HIA, which is a group of all the health departments, all the hospitals, a lot of providers in the area get together and do health improvement initiatives. And one of those that we do is our, every 3 years we do a community health assessment. And so one component of the community health assessment is this survey that gets done by a company we hire called Data Haven. And Data Haven is doing, started this survey a number of years ago. This is our 7th time using this, and it's just one component of the community health assessment that we're doing. But so they're looking to, they'll do thousands of interviews throughout the state. They'll do a couple hundred in Fairfield and the towns around here. But it's a high quality, random survey, phone survey with professional survey takers, and then the analysis is done by Data Haven, and they produce fantastic graphics. I think I've shared some of them here before, so we are in the process. I think they have 60 surveys done so far in Fairfield, and so, but what they're also doing as a part of this is they're going, so that's the random survey. And then what we're going to do is a convenience sample as well, where they're going to give us a sort of SurveyMonkey type of link that we can share on social media and other platforms and send out to people, and where we can get, hopefully, thousands of surveys completed. The better the number, the better we can rely on the data. And so we're looking to try and get, once that rolls out in a few weeks, we'll add that to our website. But we'll push it out, and I'll probably send it to all you folks and say, hey, please distribute as you see fit and for Fairfield residents. And so we're just trying to get lots of people. It actually doesn't matter because you'll select your town if you live in a different town. The data will go there. So all the towns are using the same survey, but so that way we'll have more of a quantitative survey and a qualitative survey, and hopefully if they align similar, then we can sort of say, yep, it's consistent, and so we can look deeper into some of the data of the convenience sample, if as long as the larger questions up, sort of in the question tree are in alignment with it. We can sort of look more. The fallback of the random survey is like it's good for the big questions, and it's good enough for the general area. So we will have a report for the greater Bridgeport area, and it'll be good in general for that. And the Data Haven says the 200 surveys or so that they'll do in Fairfield will be good enough to generalize for the first question. But then once you get down to college educated females who have 3 kids who are you know, and it's like, once you get down the tree, it's like, you know, 3 people answered this question. And so the further down you go, the less reliable or it is to generalize from. But, anyway, this is what we're pushing around right now, pushing out there.
Sam, can I just ask you, as far as, so Data Haven, if I remember correctly, when they first started, they didn't have a large portion of Connecticut, you know, just a sort of smattering. And that's changed over the years, right?
Yeah.
Do they have most of Connecticut now?
They have all of Connecticut now. Yeah.
So that's great. So we'll have some comparison data to, you know,
Yeah. And they've
consistent source taking.
And they've kept the same, for the most part, kept the same questions
Right.
on all the versions they did. So they kind of started in New Haven. They did a New Haven area well-being index, and then they started a Fairfield County well-being index. And they've gradually expanded throughout the state to get everybody's buy-in. And so, you know, even if the individual town doesn't contribute, the hospital for that area will contribute and say, we want our catchment area surveyed. Because this is also part of the hospital's community health needs assessment that they are required to do as well. And so.
And it's up on our social media, so feel free to share it.
Yeah. I'm a dinosaur, apparently. I said, I'll email it to you. So Santina and Emma Sharp put together a little solar eclipse safety video. I couldn't figure out how to get the video into the presentation, so I just copied the slides of it. But this slide was, you know, had Emma did most of this, and it got a lot of, what's the word? Views?
Yes.
Spread? Reach? Reach?
Hits, views,
Yes, so
followers.
it was definitely appreciated by a lot of other health departments, and they took advantage of that. And so we did have Girl Scouts and Government Day. We had a couple scouts go around with Melissa and Debrina?
Mm-hmm.
Yep, Melissa and Debrina took them around.
And I think
today.
Kim as well.
Oh, and Kim?
Yeah, I think it was Melissa and Kim this year.
Oh, it was Melissa and Kim? Okay. So they take them around, show them, do an inspection at a facility. They usually go to Fairfield U or something like that, and they do a septic system, and then they take them over to nurses and show what the nurses do. And then the health department also participated in Healthy Kids Day.
Mm-hmm.
So we had a table there, and this is Kim Wynn, one of our newer staff members. John Oldham, one of our sanitarians, retired, and Kim took his place. And so she's playing a lot of roles for us. And she and Santina just, as of last week, got their food certification. So now they're both certified food inspectors. You know, it's you know, it's like 48 FDA courses that you have to take online. You have to do.
We have to take the class.
You have to take the class at Southern. You have to take 20 training inspections, 10 training inspections with the food inspection training officer, and then they come down and do an additional 5 to 10 inspections with the state inspector to make sure you're standardized with the inspection process. So it takes, you know, takes a while to get it. It's half a year, so to get it, and so, but they both, the state inspector said they both did very well and were well prepared, which is what we like to hear. And she's already been out roughing up places.
That's
So-
great. I love
That is excellent.
Yeah, I think our definition of fantastic might be different, but it's been interesting.
So we also did, our preparedness staff helped put on a trauma for public health workers training at Fairfield U. We had about 180 people participate in that. People from all over Fairfield County. So we had the, I'm trying to remember the name of the group. I'm drawing a blank on it, but it's the crisis and trauma team for Fairfield County. So it's a bunch of psychologists and social workers and therapists that specialize in trauma treatment, particularly the, now I'm drawing a blank on the name of the type of therapy, but it's where the rapid eye movement, EMDR. EMDR, they all specialize in EMDR therapy, which is apparently the gold standard for trauma recovery, used in folks from the military to firefighters and policemen. And so, so they basically shared about what they do, and the presentation is great to hear what resources are available, but it also exposes people to the opportunity during the training to assess, like, have you had trauma related to your work or in your life, and kind of goes over, these are some things that are indicative of experiencing trauma. And so for a lot of participants, specifically like folks in healthcare that were, in the first round who were seeing people dying all over the place, is very traumatic. So it's just getting people to recognize that, yes, it doesn't have to be somebody in the military. It doesn't have to be, a firefighter in a horrific scene of people passing in a fire. It doesn't have to be a policeman who shot someone, but healthcare workers, public health workers, public health workers working in the first COVID clinics was occasionally traumatic. But it was a great training. Then we are, the health department is organizing along with the emergency management director, Chief McCarthy, a community preparedness forum where we're focusing on people with what's called access and functional needs. So it's people that are homebound, have they need some kind of assistance with transportation, daily life activities, whether you be in a nursing home, a group home, assisted living. And so we're inviting the service providers of those types of organizations to come and do a quick training and tabletop exercise with us in early June. And so those invitations just went out, so we hope to have a good turnout. We've done it twice in the past before, and we get also the senior housing providers. So we usually get 25 or 30 providers. So we're hoping for at least that, and maybe in a bigger audience, to kind of go over and just talk to them. It's really an open session of talking about, what the town can provide you, what resources the town can provide you, and then, getting down to basic things like we'll probably provide them as we have in the past, a sheet of numbers that says, if you need to call the police and it's not an emergency, here's the number. And if you need to call the health department during workday, this is the number. Out of off hours, this is the number. And just some things as simple as that we can provide, resources that we can provide for them, but also to walk them through a particular scenario. And so typically it's everybody does a hurricane scenario or snowstorm scenario. So we've got a unique scenario that we've been working on. So I'll save it for the June Board of Health meeting.
Mm-hmm.
But we did attend the Board of Finance budget meeting and the RTM budget meeting, and our budget passed with the 2 part-time positions for Covenant School got approved, and so we'll move forward with that. And then our preparedness staff has also been involved in putting on a crisis and emergency risk communication course focusing on social media and how to best utilize social media. And so we're bringing in an expert from who's been involved in numerous emergencies, large-scale emergencies, that he's been sort of the chief communications person. And so he's sort of recognized as the expert around the country. And so he's going to do this tomorrow. And so Santee and I are going to a social media workshop where we'll hopefully learn to improve our skills in that regard. And then I think I don't want to steal things from Santina, so I'm going to, because I think I stole a few already.
You did. That's okay.
So I'll end my report there. If there's any questions.
No, thank you, Sam.
She made me feel a little guilty.
Thanks, Santina.
All right, I'm on. So Sam's already talked a lot of the things about what we're doing around social media, answer the call. We're really going to be trying to push that message out, basically just telling residents to pick up the phone if they see a 203-860 or 518 number, and just letting them know that it's okay, that these people are legit. So that's the messaging we're pushing out, and we're hoping to put it up on our social media on a weekly basis just to kind of get it out there. And as Dan said, it's already on our website.
This is like right on the home page. So this is the top, So when you go, we took away all our other pictures of flu clinics that kind of rotate through the top screen. So this is static, and it'll stay there until they're done. So that the idea is if somebody gets a call, they can go on the website and go type Fairfield Health Department. The first thing they'll see is, oh, we are there doing a survey. So.
Yeah, and we'll put a blurb in the First Selectmen's upcoming newsletter. So we're getting that information out. As Stan's mentioned, we're still monitoring COVID. The cases are low. And then our immunization grant, we just hired a part-time community health worker. Her first day was today. So she'll be on for about 21 to 24 hours a week, helping all things related to immunization, increasing our capacity there. We are in the process of hiring a part-time immunization support nurse. The job posting is still up on the website, and I'll be there for about another week or so. And then we did just receive a contract for the media agency that we're working with for the immunization grant. So part of the grant, we're required to spend about $52,000 in advertising and media. And so it's actually going to be a joint effort with, it's us, Stratford, Trumbull, Apatock,
Which is Westport, Weston, Easton.
And Darien. So those are and Norwalk, that's right. Sorry, how could I forget Norwalk? So those are the major health departments, and so we all agreed on this media company, and they are going to help with advertisements from childhood immunization. So hopefully starting this summer as we gear up into school, into the fall flu, RSV, COVID, all of the things. So we're excited about that. And then, we're going to social media training. We've been talking a lot about what we want our social media postings to look like over the summer. We'll do the normal things like water safety and barbecue, food safety, and things like that. But one of the things I want to kind of focus on, and I think I'm going to bring our videos back, is, we do all of the water samples of all of the beaches and, Lake Mohegan. So why do we do that? Why are they sometimes closed? Where can people find if the beach is open or closed? So doing things like that. And if anyone has any ideas, let me know. And then just lastly, we just finished Matter of Balance. So that's the 8-week fall prevention, fear of falling program that we do with seniors. We did it at the senior center. It was really successful. We finished, it can have a max of 12 people, and we finished with 8 participants, so that's pretty good. They stayed the entire 8 weeks, and they really enjoyed it. So we hope to do another one soon.
And you were part of the public health educator video that came out recently, right?
Yes.
Yeah.
So I think that's it.
Great. Thank you very much, Cynthia. Thank you. So were there any communications? It's been 2 months, so
I have none.
I have not had any.
Okay.
Any old business anybody wanted to discuss? Is there any new business?
We have nothing. Yeah.
No new business. Anybody else have any comments or questions? Otherwise, may I have a motion to adjourn the meeting? You done?
Oh,
They all want to stay.
Oh.
They all want to stay.
We are adjourned.
All right. Well, thank you, everybody.
Thank you. Those are great.
All right, thank you.